Well, hello, everybody, and welcome back to session two of our Stem Cells and Autism educational series. I know that we have some people who are joining us today who weren't with us last week. So, in case you don't know who I am, my name is Shannon Urquiola, and I am the founder of Not Your Average Autism Mom. And I am mom to an amazing young man named Jordan who was diagnosed with autism when he was 5 years old. I am his guardian and caregiver. And like many of you, I have spent years navigating treatments and therapies and trying to find things that would help him live his best life. So, one of the things that I believe in strongly is that families like ours deserve access to accurate information when you are exploring options for your children. And that is why we are doing this educational series. Jory Scott, who is leading this conversation, has been working in biologics and stem cell field for many years and has extensive experience in this area. And I understand that he's also, are you joined by Chase today?
Yes, he's here. Hey, how's
Okay,
it going?
he's joined by Chase, who works alongside him. And before we begin, I want to acknowledge something. If you joined us last week for session one, you probably noticed that there was a lot of information to take in. This topic can feel complicated quickly, especially when I think most of us as parents are not scientists or doctors. And so that's exactly why Jory and I made this a three-part series. And also, I said earlier, but if you watch the recording, I want to apologize for you that I was not shown during the presentation. I was there. I promise my camera was on, but it was likely, my error. So I'm hoping that the Zoom settings today get us both on screen. So today we're going to really slow things down and focus on helping you understand the bigger picture of why stem cells are even being discussed in the autism world. And Jory's going to answer a lot of specific questions that many of you have when you're exploring these options. And our goal today is really to make sure that we translate the science into something that you can actually understand. So, before we move forward today, I just want to recap what we covered in session one. Jory, if parents watching today remembered only one or two things from session one, what would you want those to be?
Probably what we ended with. That, you need to beware when somebody's telling you cell counts. When somebody's selling on cell counts, I would be cautious. And when they're using the word stem cell and not telling you the actual product they're using, I would be cautious.
Okay, perfect, perfect. There's a lot of different therapies that we covered in session one. So if you didn't see that one, I would highly recommend that you go back and watch that one. And today we're going to focus, like I said, on the bigger picture so that you understand why stem cells are being talked about in autism research. We're going to talk about inflammation in the body, the connection between the brain and the immune system, what researchers and clinicians are exploring, and most importantly, what you should understand before making any decisions. So, why, Jory, would you say that understanding inflammation is so important when we're talking specifically about autism and stem cell infusion therapy?
Well, first of all, I think, as we've talked in the past, people have a couple of different theories about the causes of autism. We have our theory, which is our theory, mostly because of what we've treated in the past and how the treatments seem to be similar. We think most of what autism is somewhat, recessive genetics. But just because you have a recessive gene doesn't necessarily mean that gene expresses itself. So you have to have something that creates an action, like an enzyme that creates something to change. So what you have, in our opinion, is when you have an instance like having boosters or a severe infection or a severe respiratory infection at a certain age, we think what happens from our perspective is the body creates this inflammatory response. Well, if that inflammatory response gets into the base of the brain, the first thing that you can see happen is inflammation slows down any kind of growth within the nerves themselves actually growing up into the brain. And we think that's what's causing autism. So you have this recessive gene, there's a key enzyme that causes some type of enzymatic chemical change. Next thing you know, you have a response from the body that's inflammatory. All of a sudden, that inflammation is in the brain, it's at the base of the brain, and now you're slowing down or even can stop the development of nerve pathways going into the brain. That's why we think it's very important to understand inflammation.
And that's interesting because, what you're saying is that there's a trigger for some people that do that. And I know, in our autism world, there's a lot of people that believe that vaccines cause their child's autism. And then
Yeah,
you have other people that say, I have 5 kids and they all had the same immune system, they all had the same immunization schedule. Only one of them has autism.
yeah.
So
Well,
that's what you're saying is just for certain people, there's a certain trigger that
correct.
reacts.
Yeah, and it makes sense when you look at other things. We know that I mean, we can look at the numbers and tell you that vaccines don't cause autism because everybody would have autism. But
Correct.
vaccines can cause a reaction that can cause a genetic marker to express itself. But
Which,
it can also be just respiratory infection. It doesn't have to necessarily be that. It can be a respiratory infection, it can be pneumonia, it can be an injury, it can be a head injury that causes inflammation. It could be a lot of things, but we do feel like that there's a high probability cause that something happening in that time range of development is causing an inflammatory response.
well, you said something that just made me think about something that I hadn't even thought about before, but from my experience working with so many families with children on the spectrum, one of the things that's very common is early ear infections.
Yeah,
So that's interesting because I would say probably I would venture to say probably 80% of the families that I've worked with had early ear infections and had tubes put in their child's ears at a very early age.
that's really interesting
Hmm.
because that infection is really close to the problem we're describing.
Exactly, exactly. And you know what?
Never
I,
thought
I
about that.
just thought about that for the first time. So super
Yeah.
interesting. So, inflammation is one of those words that parents hear a lot, but many of us aren't really sure what that even means. So when we say inflammation in the body, can you just explain to us like what is actually happening?
Yeah, inflammation it's a vicious cycle, is what it is. And I like to describe it from arthritis, this side of arthritis, because everybody can understand that. You get arthritis in your joints, and it's like you get this inflammation in your joints, it never goes away, and you start seeing the breakdown. Well, really, what that inflammation is it's causing fluid to come into that area. Anytime fluid comes in and sits in the area of the body and doesn't get extracted, you end up having a breakdown of tissue. Well, myelin sheaths over the nerves are a key proponent to this. So if I took my finger and I put it in this bottle of water, and I put that bottle, my finger that far in that water, and I left it there for 90 days. After 90 days, the water line down of my entire finger would slough off. It would just completely waterlog and go away. And that's just a natural reaction to the body protecting itself. If I could leave it there for a year, it would completely just cut off at the finger. That's what arthritis is. And it's
Wow.
all caused from inflammation. So the typical response to an injury is inflammation. Then you get into a healing phase. Well, if you can't get out of the inflammatory phase, you cannot heal. And that's where we think this gets stuck. And that's what inflammation is. So nerves are extremely good at reinnervating themselves with pain. We have a pain clinic. We deal with it all the time. So if you tear a muscle in your forearm and it doesn't heal correctly, what'll happen is that nerve will signal the body to send serous fluid into that spot. And that serous fluid has mediators in it that are acidic. First thing they do is irritate that nerve and makes it hurt again. So what does it do? Sends more fluid. What does it do? Irritate the nerve. What does it do? Send more fluid. It just keeps repeating itself. So if you don't have a way to break that cycle, you can never get out of that cycle to where it'll heal itself.
Hmm, interesting. So, could you explain to us what is the difference between acute inflammation, which helps the body heal, and chronic inflammation, which just can create problems over time?
Yeah, it's real simple. 14 days. Anything past 14 days is chronic in the medical industry. So if you're talking to something that just happened and you're inside of 2 weeks, it's considered acute inflammation. If you're talking 3 weeks ago, it's now become chronic.
Okay. So basically, in simple terms, inflammation is something the body uses to protect and heal itself. But if it stays active too long or becomes chronic, it starts interfering with how our systems in the body work.
Yep. I'll give you an example. My son had a toothache last night, a tooth infection probably. So gave him a light pain med and gave him a antibiotic. Told him he's going to be on antibiotics for the next 10 days, I'm sure, before the dentist is going to see him. He didn't want, he said, I don't even understand that. I can just take a pain med. I said, pain meds don't work where there's inflammation, not like they should. Nor do you want to go in and work on this tooth because how's he going to numb the tooth without knocking you completely out if you still have inflammation in the tooth? Well, that just goes in order what we're talking about. Anytime you have inflammation, it blocks all kinds of things that you need to heal with. And so that inflammation gets into the point that you can't heal. You got fluid sitting there with, if I can't heal and my finger's perfectly normal, if I can't keep my finger in water, over 6 months and save my finger, then think about if it's inside my body. It's the same thing. Anytime you have pain, you have fluid. And anytime you have fluid, you're going to have inflammation. Nothing heals with inflammation in place.
Well, that makes sense in what we're going into next here. So, I really want to, this is where things start connecting more directly to autism. So, can you explain how inflammation and the immune system may affect the brain specifically in relation to autism?
Yeah, specifically to the brain itself, anything that you hear about the brain, Parkinson's, multiple sclerosis, dementia, uh, Alzheimer's, concussions, autism, even epilepsy. All these things are inflammation of the brain, all of them. So the only difference in all of them is each one tells you where the inflammation is located. So the name itself, when you tell a neurologist that you have Parkinson's, he knows that you have a focal point at some point in the brain that's probably where the infection is or where the inflammation is. So all those are caused by the same underlying conditions, which is inflammation. The biggest problem is getting something to the brain to get rid of inflammation. And the blood brain barrier stops that. If the blood brain barrier did not stop that, we could take Midol, Motrin, Aleve, anything like that and cure all of these conditions.
Okay, I'm going to ask you to back up. The blood brain
Barrier.
barrier, explain what that is.
That is the body's defense system around the brain, and it is uniquely designed by God, let's just say, because we don't know how it works, but
Sure.
it can detect the most micro change in anything and it directs it away from the brain. So when you take Motrin, it doesn't go to your brain to make your headache feel better. It goes and reacts to the nerve responses coming to the brain because we can't get it past the blood brain barrier to get to the brain itself. So that's
Ah.
what the blood brain barrier is. So that's why
So,
all these medications don't work. And that's why when you hear multiple sclerosis, they go, oh, well, there's holes in the white matter, and we need to attack it now because you can get past the blood brain barrier now when you probably couldn't before. It's because that blood brain barrier is blocked. It has holes when it comes to MS, and that's what they look for. They look for the holes start opening up. white spots. And that's what makes it so difficult.
So, if inflammation is present, then that could potentially affect how the brain communicates.
Absolutely, it does. I mean, take it when you have a concussion. Uh, I remember getting concussion when I was in an event one night, and I remember, and of course, in show one, we found out I was a pro bullfighter at one time. One time, I got literally kicked right here in the frontal side of my head, and when I came to, I had five guys holding me, and I was trying to crawl into the back pen to jump on the bull that kicked me, and it was a total response. It was just a
Mm,
response from the impact to my head. I don't remember anything from the impact to the time they stopped me, but when they finally stopped me, I'm thinking, what was I thinking? But I
yeah.
wasn't thinking at that point because the brain completely changed how it was working and how it was flowing information to my body. Well, it's the same thing with all inflammation.
So, is that part of the reason that, researchers are studying therapies that support reducing inflammation in these neurological conditions?
Absolutely.
Makes sense. So, before
100%.
we move on, I just want to share something really quickly just from my own life with Jordan. I remember when Jordan was younger, there were times when his reactions to things didn't make sense to me. Some days he could handle something just fine, and other days, the exact same situation would completely overwhelm him. And
Right.
as a mom, I remember thinking, what am I missing here? Why does this change so much? And I think what I didn't understand back then is that sometimes there are things happening inside the body and brain that we can't see.
Yeah.
And those things can affect regulation and behavior in ways
Absolutely.
that just aren't obvious to us. So, Jory, when parents see those kinds of fluctuations, a child doing fine one day and struggling the next, could
Yeah.
inflammation or the immune system activity be part of that picture?
It's very possible. Um, I'm going to tell you how Dr. Cole explained autism to me. Autism is sensory overload, which is very similar to like having an allergy. You can be allergic to dogs, cats, and trees, and you can go touch a dog and not get an allergic reaction. Tomorrow, you can go touch a cat, and not get an allergic reaction. The next day, you can touch an oak tree and not get a reaction. But one day you can touch a dog in a tree and this allergy reaction shows up. And it's because it's all congruent. They stack on each other. So I think it's very similar in this. It probably has something to do with inflammation, but it could be they're noticing more that day than they were the before, and it just a little bit more causes an overload reaction, and you kind of get that outburst. So I think it could be a mix of both, one or the other. Uh, who knows? But that would be our theory behind it.
Right, right. And so that's how, when I often talk about autism, I talk about, think about being in, a super packed sports bar, sitting at a table with, four of your friends. And we, as neurotypical people, we can filter out all the other conversation and the lights and the music in the
Correct.
background to focus. Where if I'm sitting there with Jordan, he's taking in all of that information and his brain's trying to figure out what to do with it.
In stereo,
Yeah,
by the way.
right.
You know,
Amplified.
it's amplified in stereo. Everything they feel, see, smell, or touch, and think all at one time. And it can be just one thing more today than normal, and it's just too much because you can't separate it all. It's like watching six TVs through one screen at one time. There's no way to make sense of that because it's too much noise. But if I can
Right.
separate it into three, it's better. If I can get them back to the six where they're supposed to be, well, now I can absorb the information and I can relay the information back out. It's back to autism is not brain damage. Autism is neuro pathway damage. And that's where I think we get confused a lot of times is a lot of things we're thinking about. We think what's going on in their mind, it could be more, it's just what all is coming to their mind right now. And you're getting a result of that.
Right. That makes so much sense. So I just want to say to all the parents that are here listening, just so you know, when you don't understand it, it's okay because it's frustrating for us
Absolutely.
sometimes.
Yeah. They don't understand it and it's okay.
Right, right, exactly. So, I want to kind of navigate to, the immune system's job is to protect the body, but balance is the key. So, Jory, what happens when the immune system becomes overreactive or underreactive, and how might that affect autistic children?
Well, I think the overreaction is what's causing the inflammation. Uh, Underreactive may be what's happening later. So what you end up involved is you can have this reaction which causes your inflammatory response anywhere in the body, not just in the base of the brain or the neck. Then all of a sudden the body kind of backs off and leaves it there. So now we get an underreaction and it's kind of it's stuck. So we get an overreaction, then all of a sudden we get an underreaction. And I think that's how it happens in autism.
Hmm. So, how could uh, immune system imbalance potentially affect the neurological conditions?
I think it's back to what we've been talking about: inflammation cases in the brain. The body is not any better at clearing up some of that than it is at anything else. So I think it's different than a reaction. I think a reaction is something that's caused because you have an immune response to an actual agent.
Right.
So kind of like COVID. COVID is really based on inflammation. So when you get COVID in your body, it goes to your lungs and it attaches to the type 2 receptor site on the lung cell, which in response, like what we're fixing to talk about, the immune system says, okay, you need to blow up and kill the COVID virus. Well, that's what happens. Well, some people react to that like it's an allergy, and all of a sudden they're barely surviving or they don't survive it. And some people don't respond to it at all like it's an allergy because the body just doesn't recognize it as a problem because the lung cell's doing exactly what it needs to do. So it's not the COVID that's the problem. It's how your body's reacting to the lung cell exploding. Some people respond with an immune reaction, which causes all this inflammation throughout the body. And some people don't respond to it at all and really never see any effect from it. So I think there is a difference in immune response and inflammatory responses. I think
Hmm.
inflammation is more looked at from an injury to healing phase than it is as an immune response to something.
That it, I mean, that really just makes so much sense to me. So, this next slide is, about something that sounds simple, but I think it's incredibly important as to how the brain communicates. So, Jory, can you explain to us, like, how do brain cells send signals to each other?
It's really chemical and electrical impulses intermixed. Some is inside the cells, some is between the cells. And so what I like to explain it like putting wires in your house. Like everything you plug your lamp to or whatever, there's a receptacle there. Well, that receptacle has a three-phase or a three-prong wire going through the wall all the way into your box in your house where your power comes in. And it's insulated. So the only way to get power out of that plug is to plug it right into the prongs of the outlet. Well, if all of a sudden the myelin sheaths or the covering of the wires start breaking down, what happens is it just starts arcing somewhere, anywhere in the wall, and you have shorts. And all of a sudden that quote power or information isn't getting from the panel to the receptacle like it would be getting from the brain to the eyes, the fingers, the skin, anything, because it changes. So you have painful stimuli and non-painful stimuli. So painful is 3 times to 4 times stronger than non-painful. And the way to explain that is if you bump your head, you always rub your head in response to get it to quit because you're trying to rub 3 to 4 times more non-painful stimulus to stop that one painful stimulus. And so what happens is when the brain is sending these impulses out for information, the number one problem that's having in our opinion is that myelin sheath is wearing off, and all of a sudden where you were getting a a normal, non-painful response by grabbing something, looking at something, touching something, feeling something, smelling something, all of a sudden it turns into painful. And it's the brain is acting like, hey, this is okay, this is non-painful, but when you grab that bottle, all of a sudden pain shoots up and goes into your brain because now all of a sudden you have wires that are shorted out in here, and it all it has to do is hit one painful stimulus, and all it overrides all the non-painful.
And that
So
sends them into that fight or flight mode.
sends them into fight or flight mode. So it can be a lot of things. It can be overload, but with neuropathy, it's what we just explained. Well, we believe neuropathy and autism are almost exactly the same. And so it just starts changing, whether it confuses the brain or whatever it's doing. It just starts changing the process of what's happening, and it can be changing anything.
So let me ask you this. So if those pathways are disrupted, what kind of things might, you know, what kind of things might we see in our kids kind of on a day-to-day basis?
Um, it can be the overload that you see, the getting expressive, getting
Meltdowns?
anxiety, things like that. That is all caused from this. Uh, some of the gut may be from some of this. I think a lot of it's inflammation too, but it can be a lot of things. It can be their feet hurt when they walk. It could be, their arms tingle or feel numb. It can be a
Because
lot of,
a lot of our kids, not Jordan, but a lot of our kids are toe walkers.
yeah, and exactly. It could be simply they could have pain in their calves. They could have pain in their heels. It could be anything, but it more than likely is caused by what we're talking about.
So interesting. So what I'm kind of understanding here is that like when communication is in the brain is disrupted, it can show up in ways that we see every day but don't understand,
Absolutely.
right? Like things
It
like
has to,
emotional regulation.
yeah, it has to be happening at some level.
Right.
If
So
and it's
just
not
so
just,
you guys understand, like emotional regulation, sensory overload, difficulty processing information,
yeah,
sudden behavioral changes. So I think that's why researchers are exploring therapies that, might support the body system to improve those neuropathways, correct?
yeah. I don't know if they know why they're doing it. Um, because I don't know what a lot of people think is really the cause, but it totally makes sense that I think all physicians across the board agree that inflammation is a major problem. They may not put it as the problem, but it is without a doubt across the board. Everybody would agree it's a major problem.
Well, I mean, it seems to me like I mean, it makes sense what you're telling me. And I think, this slide is kind of one of the most important ones for us as parents because many of us have been told at some point that what we're seeing is just simply behavior, right? I know
Correct.
I heard that many times when Jordan was younger, and I think while behavior is certainly part of the picture, what we're learning over time is that the body and brain are deeply connected.
Absolutely. I think the gut and the brain are very much connected. I've done a lot of research on my own, and especially in the last 3 to 4 months. And I can tell you there are histamines that are released from the gut that cause inflammatory problems throughout the body. And I'll give you an example. My wife has headaches all the time. We have a migraine clinic that we own. and we couldn't figure out how to get rid of these headaches. She started taking an enzyme to cut down on histamine production from the gut issues, and in the last 3 weeks, she's not had a headache.
Wow.
So there's no doubt the gut is connected to inflammatory conditions in the body. There's a
Yeah,
lot.
and what I'm understanding is that I think that understanding that connection can completely change how we think about what our children are experiencing.
Absolutely. You
So,
know, I was talking to a lady the other day. I can't remember the daughter's name, but anyway, the daughter's 15, and she's been through some trauma, some serious trauma, from when she was, I think, 3 to 7 years old. And we started talking about it. And this child doesn't have autism, but her brother does. And we start talking about how she's responding to things, and I'm like, we need to treat her because this is a neurological issue and it's from the same thing. It's just understanding that inflammation and these pathways, you don't necessarily have to have autism for it to cause similar problems in the body. It's kind of across the genre of things. It's just
so
in
you're
this
so
in
she
this
had
instance,
trauma.
yeah, she had mental trauma.
Okay.
She was sexually abused repetitively by a babysitter, a 64-year-old man, by the way. And she's 15 years old, and she will just all of a sudden have these outbursts and go literally crawl in the closet. And I was sitting there talking, and they weren't tying this together. And we were talking about it, and she just happened to mention her daughter, and like, your daughter has an onset of kind of like post concussion syndrome, and you're getting the same kind of results just in a different way. And so we're fixing to treat her. We're going to give it a shot.
That's amazing. And Jory, you know what? I don't think that we talked about this in the first session, and just because you just brought it up, will you just share your story on your concussion syndrome?
Sure. Um, while I was developing this, I was a pro bullfighter for, I don't know, 10 years or so. And I I don't know how many concussions I received, well over a couple hundred. And I had a friend of mine that her brother was a rodeo contestant out in Montana, and he had committed suicide. And she gets on Facebook and starts talking about the way he was acting and all this. And I realized I was acting the same way. And I said something to her about it, and she contacted me and said, "You need to go talk to somebody." Well, I'm thinking, I don't really need to talk to anybody. I'm fine. Well, over the next 6 or 7 months, I started having severe breakdowns, like 4 or 5 a day. And finally, I went and told somebody. I told her I had told somebody. Well, we weren't thinking much about it tying into the product I developed, but I was the first patient. And from the day I did my first infusion, I've never had another one. And so that's my tie to concussions. And that's why I'm into the concussions and PTSD. I worked in PTSD at the VA in Jackson, Mississippi for 3 years. I got a minor in psychology. I take a class right now on functional psychology, which I really like. It's cool. But that's my background into it, and that's my experience from it.
Yeah, I just thought that was amazing, and I mean, Jory and I talked about it a little bit more in depth, but it was his symptoms were severe. I mean, where he would pull off the side of the road,
Oh, yeah.
just driving down the road and couldn't drive. So,
Correct.
and one infusion, and you've never had an issue since.
Nope, never again.
Super interesting.
And
So,
I had even had an EEG done, and they found that I'd lost 17% of my word recovery, and that I had scarring in my right front temporal lobe, which would correlate correctly with that problem. And so I probably can tell you 3 or 4% of the time I feel like I have word recovery issues, but before it was extremely bad.
And just so everyone knows, I have encouraged him to go back and get another EEG now so you could see the difference.
Yes.
I
Yes, I
did do
forgot
that.
about that. And Chase
So,
is here listening, and he does the EGs.
Yep, let's go.
oh, well, there you go. Okay, I have
See, I hadn't
suggested
told
that
him that.
I have suggested he gets another one so we can look at it.
We'll get that going for sure.
Okay, perfect. That's awesome. So, from a clinical perspective, why is it important for families to understand that what they're seeing in their children may have biological factors connected to it?
Um, I think it's important just simply because you got to understand the biology to understand that where we think the answer to the cure is. And that's why I think you really got to come in with an open mind. But I'm going to say this, and I said this on the last show, and I think I've said it to every podcast I've ever been on. Autistic families are not like any other in the entire medical world. They may have more information and understand it better than most physicians, and they understand beyond the rest of us that the medical industry has failed horribly on chronic conditions. It's just what it is. It's 90. We've turned into 90% diagnosis, uh, about 8% treatment orientation, and everything is a drug therapy or a surgery.
Right.
And if we can't do it with that, we kind of back off and just say, well, it's a behavioral pattern. And it really is. We know well enough now that these behavioral patterns have a biological background to it.
Okay. Love that. So, I want to bring it back to kind of the, stem cells conversation now. So, when stem cell infusion therapy is being explored in autism, what biological processes are you guys looking to support?
The biological process that we are looking to support, or I think all companies should be looking to support, is the fact that if you look at somebody like you and I right now, we probably have around 150 million, oh, well, 150,000 stem cells floating through our blood right now. Chase may have a few more. Uh, Children actually have less. So if you know that you have these cells are also surrounded by peregrine factors and organelles and things like that that are really anti-inflammatory and anti-cancerous. That's why it's very unusual to find somebody under 30 that has any type cancer. It's because so many of these anti-cancerous cells are just in the fluid that it's hard for anything like that to get developed. And so I think if you're talking to anybody that's doing some type of stem cell or cell therapy, you need to be wondering or asking or thinking, how is this going to systemically change this system right now? I mean, if there's 150,000 cells floating through my body at any one given time, and I'm going to put 50,000 or 100,000 in there, how long is that going to last? And what's that really going to do? And what was that really probably designed for? What number really makes the body reverse and kind of stop in its tracks and do something different? And I think that's what we're trying to find out.
So, I'm going to ask you a question, and I'm going to be honest. I don't know if this is the right place to ask the question, but I'm just kind of like that
Yeah,
because it
go ahead.
came to me. So, when you talked about earlier the brain barrier,
Mhm.
basically that we take something, it doesn't get into the brain. So, what makes the cell infusion process different that it can get through that?
Because there are no RF factors on the peripheral of the cell of the stem cell. So if I take your stem cells and my stem cells and Chase's stem cells and we just harvest them, don't mark whose is whose, put them in the table right here and we pick them up and infuse them. You can't, your body doesn't recognize yours any different from mine. So what the body does take to the brain is blood. And every part of blood has to go to the brain, which is those factors we talked about before, and stem cells. So those are things that the blood-brain barrier does not recognize. And so it will carry these factors through the blood-brain barrier, just like it's bringing water. And it'll bring it to those locations. And that's why we like cell therapy. Is simply because we've treated over 1,000 patients and observed these things and read over a couple of 400 or 500 studies. Everybody is in agreement that this stuff works. You
And
know,
I think that's key. I mean, I'm really glad that I asked that question because those two things, right? Like inflammation, you can't get things to it, but through the bloodstream, infusing the cells, you can.
yes,
So,
that's the only way to get them there unless you're going to do surgery.
right, right. So then the goal primarily is to support inflammation, regulation, immune imbalance, and communication between those systems, then, right?
Correct. And here's the thing, I don't like the word stem cell, and
Yes.
we've discussed that in the past. Most of what people are getting is not stem cells,
Right.
uh, but we're in the past on that. So here's here's to understand, and it took me a little bit to figure out a way to explain this. I can develop a stem cell, but I can't force it to go anywhere in your body. And the way that I can explain that is if we all told our kids to go to Applebee's, but we couldn't drive them there, and we put them in a cab and told them to go to Applebee's. The cab can drive them to Applebee's, but they got to get out of the cab and then open the door and go in Applebee's. Well, once they get out of the cab at Applebee's, they can go wherever they want and tell you they were going to Applebee's. Well, that's the issue with stem cells. They can't be directed. There's no way to direct a live cell. And we're 30 years from that, probably at best, before anything like that could be released into the public. And so that's kind of what you got to realize. So we have realized that the body typically wants to take care of a few things first: heart and brain and lungs. Those are like the top three. And so, what we have noticed in studies that we've read and people we've treated is we treat more to the symptom of the disease or the condition than we do treat the condition itself. So there's a lot of things that we can treat. I can't do anything about the genetic issues with autism, but I might can get rid of all the symptoms and you never see it again. It may never come back again. It's kind of like having Parkinson's. You can have Parkinson's. I can test you in my lab and see if you have Parkinson's. If I find Parkinson's in the test, you have it, but you may never know you have Parkinson's your entire life. And so that's the difference in what we're talking about. And so really what we're wanting to do is flood the body with enough peregrine factors and cells and anti-inflammatory products that are microorganelles or nanoparticles, people want to call them, or exosomes that people want to call them, and stem cells, so that the body is overloaded with what it needs and it can start knocking out things that we call it frequent flyer miles, because you can have one condition and nothing else, and all of a sudden you get diabetes, and all of a sudden four other conditions show up because the body can only fight off so much. Well, if we can flood the body with enough cells, the body can start knocking off those flyer miles and get back to the one thing that may be the issue. And then if we can flood it enough to help with that issue, we might get you back to the one problem you had before, and it might make and keep it there.
It just makes so much sense. So I just want to say, like next week in our third session, you're going to give more examples of specifically what you're seeing in the autistic children that you're working with specifically. But I just wondered if you could share, like, just give us some simple examples of what kinds of changes you're seeing through this.
Mostly what we see, and we've been talking about this, and I want to go over the things we see the soonest or the quickest, and that's typically a reduction in gut issues and a reduction in anxiety. That's like the two things, and things come out of that we can add to it, but it's really from that. So you have more comprehension, you have more of an ability to speak. What were you saying?
More awareness.
More awareness. I mean, Chase is seeing it for the last year. More awareness. They come in, they're scanning the room where they weren't doing that before. A month later, they come in and they're speaking, saying hi and waving. It's just that's what we're seeing. But I fully think it's the number one thing is reduction in anxiety and the reduction in the gut issues.
Which I think for most of us, listen, I mean, for me, I know specifically for my son, you know, anxiety was in my world, in our world, was bigger than the whole autism thing. Anxiety
Yeah.
is what caused all of his issues.
Yeah. And we see
So,
that with most children that come here, it's an anxiety issue.
right.
You know, uh,
And when they do the EEG, it shows the reduction in
yeah,
anxiety.
I forgot about that.
Yeah.
The when we did our first study, we brought in, I think it was 7 children from Dallas that had had a previous EEG, and their alpha waves had escalated to an abnormal level. All 7 kids that we had treated went back within 6 months and did EEGs, and all 6 or 7 kids, but it was 100%. All of them, their alpha waves went to normal on the EEG.
No kidding. After their
Yeah.
infusions.
Yeah. I forgot about that.
Amazing. So, before I move to the next slide, I just want to share something that was sent to me by a mom in our community, and her name is Bobby. And she registered for this webinar. I'm not sure if she's on here, but she told me that when her son Caden was 8, and then again when he was 10, they actually traveled out of the country for
Mhm.
infusion therapy. And she shared with me that they saw amazing gains, that her son went from being nonverbal to completely verbal, which was just incredible. And she, she ended it by saying, I'm glad you're sharing this information because I can tell you, I am so glad that I made the decision to do it. So, when families share stories like that where they notice meaningful changes after infusion therapy, Jory, what might be happening biologically that could explain those things?
What's happening, in our opinion, is the neural pathways in the brain are getting to develop. I mean, you don't have to develop the full array of pathways you originally were going to have for the brain to function. The brain has this unbelievable ability to adjust. It just has to relearn the pathways. And I think that's a lot of what we're seeing because I've told you we've had some children come in and they come back 30 days and say hello and they never spoke before. And I'm thinking, I was in the orthopedic world and I can't get an ACL recovered before 85 days. And that's one of the fastest times in the nation. And in 30 days, this child just walked in and started saying hello.
Right.
And I think it's simply when you get rid of that inflammation, the body will continue to heal and follow the original plan that it had. And that's what we believe. And that's what we think we see. And that's why we think we see what we see because kids can come in here, and I would say a high percentage of them. And of course, hopefully by the first year, we're going to have true data because we're fixing to start our data collections. But we'll have children that come in, and you're just like they're developing faster than the brain could correct itself. And you just realize that the only logical thing is they don't have brain damage. They just have neurological pathway damage. So they obviously are hearing their surroundings enough that they catch up pretty quick. And that's what we think. We're pretty convinced about it.
That it makes a lot of sense. And I just want to say, I shared Bobby's story because she had sent it to me. Obviously there's no guaranteed outcomes, but I think those stories do help illustrate why the topic has gained so much attention in the
Yeah.
autism world.
Yeah. So
Um, So in session one, we talked about something that caught a lot of parents' attention. So I'd like you to just go a little deeper into that, Jory. When parents are researching infusion therapies, and they see extremely high numbers. You mentioned this before. Why should that raise questions?
That should raise questions. For one, typically the numbers are biologically unattainable. Uh, we have pretty good high. We have the highest numbers that are collected without growing or expanding. But there are companies that are claiming they have the same numbers that we do after culturing them and expanding them. They don't typically see the results that we see. And we've had several families that have been out of the country, some 3 or 4 times, that saw no results. And we came in and treated them. And one is a family that I'm sure when you visit, we can connect you with. Their pediatrician says he is no longer can claim autism. And so,
Wow.
I think it's the numbers thing is what's being used to, and I call it to do this the Black Widow thing to let you think that, hey, this is the real deal. But the
Sure.
reality is you can't biologically get those numbers. You can't
Right.
expand it and
I
get
I
those numbers.
learned a lot about that. The expansion of them last week was very interesting to me. But so for families watching, the number alone doesn't tell the full story about the therapy, correct?
No, and the reason is um I don't think stem cells are maybe the real answer. I think stem cells are part of the answer. But I think if you process, I'll give you the example of exosomes. I happened to talk with Mary Margaret Birch, who's a nurse prac. I happened to do a speech with her a couple of weeks ago, and she and I ended up getting to do a Q&A for 2.5 hours. And she and I agreed on every topic we're talking about. And what we came out and decided is that, the numbers, uh, the stem cell itself dies pretty quick. I mean, stem cells only last 30 to 60 days in your body at max. If your body doesn't need them, they can last up to 90 days. But the people we're treating need them. So we know the cells aren't lasting more than 30 days. So the reality is if a stem cell is a one-time and done thing, how is the stem cell itself actually producing the results that we want? And we don't think they are. So we think that it's the mix of everything and concentrating and get the right concentrations. Exosomes are what's left over if from your stem cell process. Well, if your stem cells aren't effective, your exosomes aren't effective either. And so there's no need to, we don't feel like there's a need to separate some of this stuff. We leave a lot of it together because we think there are other things that are way more important. And actually, some of our future process is going to be getting some of our stem cells maximized to their most potential and then changing them. And we
Makes
actually
sense.
think that's going to be the best product that's ever hit the market.
So let me ask you this, because I think a lot of parents that are watching might be wondering what it means when they hear viable stem cells. And second, why is that important when we're talking about infusion therapy for autism?
Well, legally by the FDA, I can't tell you it means anything that they're viable or not viable. But viability means the percentage that are alive. And the other side of that is the FDA likes to consider that your harvest technique, if you have over a certain percentage, they consider your technique is valid. And if you have a lower percentage of stem cells that are viable, they kind of frown on it and say, well, maybe your harvest process is not good. So what we found is through my patent, and it was an accident. I won't act like we knew what we were doing. We figured out how to increase the cells from 68% uh, validity all the way to 100%, and that simply means how many are alive. Now, the reality is the FDA does not allow me to tell you that live stem cells are more effective than dead stem cells. Then I've become a drug. But I can tell you how many of them are alive when you're getting treated. And I do think that's something people need to understand when they're talking to somebody. How many of these cells are alive, and is there a piece of paper that shows it?
Absolutely. You talked about that in session one, and I think that is really, really important.
Yeah.
So, um, I think speaking to the families that are watching, when you start researching stem cell therapy for autism, you're going to see very different claims from very different clinics. So, Jory, when a family is evaluating this therapy, why is it important to understand how the cells are processed, measured, and prepared, not just the number?
Because most of what you see out there is being purchased from a lab that is a general lab that anybody can purchase from. And I created a list of Educate Me products that
Yep,
I sent you, and we're
I got
fixing
that
to
this
put it
morning.
on our website. And I tried to go through it after we talked the other day. I decided, this is really important. So I tried to go through, put this together, and break it down and make it where it's a little bit easier to understand. But I have this list here, and real quick, if I just flip to the back of like cord blood, main concerns are low cell counts, typically not effective cell counts. Amnion, not approved for injections at all, not designed for or approved for infusions at all. Bone marrow, the same thing, not designed to be infused, very limited numbers allowed, cell counts are low. Let's get back to stromal vascular fraction, not designed or approved to be infused, only applicable if you're actually using it at where harvesting it and applying it in the surgery. So, I mean, most of the products that people are using out there are not approved for what they're using it for.
Gotcha. So I think, for families listening, the big things to ask about are how the cells are counted, how viability is measured, how the cells are processed, and what is actually being infused. Like you said, you give a printout of what's actually being infused.
Correct. And that's with anybody that's processing their own product. You could put together something to count cells, but amnion has no live cells in it.
Right.
Cord blood literally doesn't have enough for you to do but one treatment, probably the entire uh, per harvest. So different things just don't have the cell counts, and they most of them don't have live cells that are of being used in the autistic world. Most
Right,
don't have
right.
live cells.
And I think, for parents, when it comes to your child, you want clarity. You don't want
Yeah,
marketing.
yeah,
So
and
that's something important.
the other thing that really bugs me, and I shouldn't say that, but I'm going to. You got these labs outside the U.S. that say they're FDA registered. We looked them up, and it's public knowledge. You can look them up. We looked those up. They are FDA registered. They don't have a single product registered under the FDA's registration. Not one. So they yell, we're FDA registered lab, but the product you're receiving is not coming from the registration of the FDA. Well, they're not in the country, so the FDA is not going to come and check them. It's nothing but a sales ploy.
Yeah,
So
it's a marketing ploy.
it's a marketing play. We are registered with FDA as a registered lab, been that way for 9 years, and uh, we have the registration of the product that we're using. That process is registered under our FDA registration.
Right. So
We
that's
we haven't,
important.
yeah, we haven't found anybody else that has one, and I could be wrong. I'm telling people to look,
You can
Right.
but
literally go online on your phone and search the products that they're using. They
yeah,
have them for sale listed,
yeah,
and it's very easy to find.
yeah.
Instead
So
of just the facility, the actual products.
correct. Yeah, I don't
Gotcha.
know. I don't know of anybody. Um, and I don't want to name a name. I may know one, and one of the companies. I'll say Panama. I don't think there's a problem with Panama. I don't think they're necessarily misleading as much. I think they do run a sales technique. I don't think we have the same product. I think their product is completely different from ours, and I get that from probably 12 or 13 patients that have been there and been here.
Right.
The whole process is different. Do I think they're bad? No, I don't think they're bad. If I was going to pick one to go out of the country, they would probably be the one I would pick
Well,
simply
that's actually
because,
where Bobby went, who sent me
yeah,
the email. That's actually where she went.
yeah, and not because I'm going to defend or applaud their product. I do
Sure.
think they're safe. And I do think they're going to go through, I do think they make the measurements to go through the best process they can. I don't think anybody else is doing that.
I gotcha.
And, but like I say, but they're not telling you they're FDA registered lab,
Right, right.
you know?
So, and I just want to say something just kind of, parent to parent. I think that when you start researching treatment for autism, especially something like stem cells, you're going to see a lot of big promises. And as a mom, I understand that feeling of wanting to explore anything that might help your child. But, I think the most important thing we can do is slow down, ask questions so that we can make informed decisions. And, I think, Jory, you've explained a lot of that for us, which is really important. And I think this next slide, this is important because expectations matter. And so I just want to ask you, in short form, kind of, what should families realistically understand about infusion therapy for autism?
It's all about the cell numbers, 100%. Uh, we think you need to have, but this is for our product. I produce
Right.
my own product. I have my own patent. I have my own stuff. So I'm speaking for me. We think you need to have over 4 million cells per infusion to get any kind of response. Now, that's just stem cells. There's 600 times more other things in there with it. But if you're with somebody else on a different product, the number is going to be different. And I can't tell you what that number is. And so that's what I would try to say is understand is it's all about the numbers. And if I give this example, and I've told you this in the last thing, if I'm giving you 60 million cells in an infusion and somebody else says they're giving you 60 million cells in an infusion and we don't see the same result, then somebody's lying. And it's just that simple because stem cells are stem cells. Nobody has different ones. Nobody has something unique that somebody else doesn't have. It's who has the most and who has the ones that are effective. And effective is way more important than the number. So the one thing I refused to do was get into the numbers argument. And I had to break off with a group out of Dallas that's treating autistic children because I would not agree to elevating our cell count numbers. I'm just not getting into the cell count number argument. And it came to a point we finally had to just separate because they said,
Well,
well, we can't compete if we don't say 250 million stem cells.
see, and that's the thing. Like, I think that what I'm hearing from you is be aware of the people that advertise super high inflated numbers, but also the process that you're using, the stem cells aren't necessarily the most important part of that. It's everything else that's with it.
Correct. And I can look at their bottle. I mean, I saw a guy hold up a 2 ml vial bottle and said there's 253 million stem cells in this bottle. That's impossible. I mean, you couldn't put 253 million stem cells in less than 65 cc vial, 5 milliliter vials.
Well, and
You
that's,
know,
you have that knowledge. As
correct.
parents, we look
Yeah.
at it and go, wow, 250,000. Okay, that must be good.
Yeah. The
That's
most,
why education, I think, is so important.
yeah,
And, I want to jump here because I think that, safety is always the most important conversation. I mean, so,
absolutely.
Jory, what safety considerations should families understand before considering this?
The safety considerations is understanding one is where did the product this company is using, where did it come from? Because like amnion is freeze dried all the way down to a powder. Well, I actually had a very high profile person borrow my lab one day to do an injection from another company. And they walk in And we're looking at the vial, and the powder in the bottom of the vial is oblong, uh, spherical particles. They're not perfectly round, which means they are not designed to be reconstituted to be put into the body. And we're looking at this, and the guy doing the injections looks at me and says, I wouldn't be putting this in my body. And I said, well, why are you putting it into his? And we started laughing about it. Well, they don't know any better. And we're looking at this going, this is a powder. And the way you can tell a difference in something that's made to be reconstituted to go into the body is it will be a pellet at the bottom of the vial, like one solid pill at the bottom of the vial, because it's so uniform and so micro that it absorbs, it liquidates instantly as soon as fluid hits it. Well, most of, if not all, matter of fact, all the Ambien products that I've seen that are in any type of vial, they're powdered form and they look like salt. You can shake them, they're loose. That is not designed to be reconstituted and put in the body. It's not designed, there's nothing about the medical field that says that is designed for that at all. So if you take that and put it into your blood system, you can cause a stroke. And so we know that just by chance, this one person I'm talking about, after his second treatment here, turned blue. His best friend called me
What?
and said he is turning blue. I said, well, he's probably had a stroke. I
Wow.
mean, micro strokes will turn the face gray and blue. And sure enough, he was turning gray. Well, he didn't do any more injections. And I'm
That's
like, shouldn't have
crazy.
done that. So there's things to understand is be real in tune to what's going into your body.
Right.
And there's
Right.
just very, very few products out there that are really designed to go back into the body. And just because it's good enough for injection does not mean it's good enough to go into your bloodstream. I can inject a lot of things into my muscle that I might not should inject, but I
Yeah.
can't put anything in my bloodstream that's not supposed to be there.
Right.
And then the next thing is how they're actually delivering these. If they're pushing it, which I know of some families that went out of the country and they're putting it in a syringe and sticking the needle, and they had this child with both arms pinned down doing a push in both arms. Uh, if they're doing that, it's a very weak product. It's just that simple. So it's just trying to understand what's going into your body. And I would be very, very concerned about anything that's not going into an actual bag and is not being dripped over a long period of time.
Okay. And just so everyone knows, we're going to talk a lot more about that next week. So I just want to say, this topic brings up a lot of questions, and that's a good thing because that means that, families are thinking carefully about what they're hearing and trying to understand what it really means for their child. And we received several questions already, and I want to make sure that we answer some of the
Yeah.
ones that our families are still wondering about that came in after session one and earlier today. So, can you? Well, no, I'm not. I'm going to skip that one because we're going to go into that next week deeply as into the process.
Okay.
But so the goal is not to replace brain cells, but to
Um,
support the healing process and reduce inflammation, correct?
100%.
Okay. So I got a couple questions from Denise after last week's session that I want to be sure that we get answered. One of the questions she asked was, how long do improvements from an infusion typically last?
We've seen it up to 3 years. And
Okay.
we're not sure that it stops because once you start a healing process, it's kind of a it's kind of a percentage direction at that point.
Gotcha. Um, what factors are you seeing that influence how long benefits may last from one child to another?
We haven't seen any child reduce back from what they've gained
That's
ever.
important. That's really important. And I know you're going to give us examples of that
Yeah.
deeper next week. She also asked her another really important question, which I think you've answered throughout this, but she asked, is this specific to autism or does it help more broadly in our kids? And I think you answered that really.
Yeah, it's broad. I mean, we don't treat just autism. We treat concussions, PTSD, strokes. Strokes is big. The big thing right now is congestive heart failure. We're treating congestive heart failure with just insane results. So we actually been talking about that all morning with one of our clients. So no, we treat a broad thing. We've just kind of have narrowed it down to neurological conditions, which I know this is weird, but congestive heart failure is a neurological condition. It's actually not a heart condition. And so we started with diabetes. We see a big help with diabetes, but we've been through that. But what we found is the neuropathy and the diabetes was healed. Well, then that moved us into, well, will it work for autism? Well, it's the same basic thing if it's a neurological nerve conduction myelin sheath issue. Well, that's exactly what the problem is with concussions and strokes is it's inflammation. It's not actually the stroke that kills you when you have a stroke. It's the pressure of the inflammation that presses down on the stem of the brain that kills you 2 or 3 days later. Uh, and Dr. Cole, our physician, is a survivor of that. 98% of
Wow.
people don't survive those strokes, and he did, and they can't even find where he had the stroke anymore. And then congestive heart failure is the same thing. Congestive heart failure is the myelin sheaths of the nerves that are innervating into the heart are breaking down from inflammation.
Which
So,
is what we think your thoughts are on autism. So,
yeah.
another parent from our private membership that I work with asked something that I think a lot of adoptive families would like to know. And, maybe you'll talk about this more next week when you talk about your process exactly. But what would be different if the child is adopted versus biologically related to the parent?
Uh, for us, nothing. We can deal with that. And I don't really want to get onto that topic
Yeah.
uh, simply because it's some of what we're doing in the future.
Okay.
But we know how to do that. We've done that more than once.
Okay. Perfect. And um, let me just finally, if a parent is, let's just say we have a parent on here that's feeling overwhelmed by all this information.
Mhm.
What would you want them to understand the most before they dive any deeper?
Um, probably the thing that you and Mike and I talked about. It's not a guarantee, and Mike is hardcore to move here to run this company. I want him to. We're just kind of waiting until we get to that point. But, I know people in the autism world think 20% is a great number, and I don't. You know,
Yeah.
I want it above the 50s and up in. I literally feel like if I can be turned loose to do what I want, I can eliminate 95% of the issue. And I'm about that close to doing it. So I'm just that way. I don't think 20 is enough. I'm not happy with 20. And if somebody comes to me and only gets 20%, they're probably going to get a whole new set of treatments at a huge discount or a donation or something because that's not my goal here. My
Right.
goal here is to create something that makes an impact. And we're not going to make impacts by just selling facades. And that's just something I'm not into.
I got
And
you.
and to tell you something that I can say about the previous question, the reason I can treat adopted child is I removed the white blood cells from the product. And that's part of my new patent. And nobody else is able to do that. And so when I remove the white blood cells from the product, nobody's going to have any reaction or rejection. And that's part of what the new product will be in a year or so. That's going to be the drug is we removed, and I can kind of say it now because I've already got the patent applied, but we remove all the red and white blood cells from the product, and white blood cells are what cause a reaction or rejection. And you got to have 11,000 micro units uh, per milliliter of fluid in the body to create a rejection. And I've reduced that by 98%.
Wow. Yeah, that's amazing. You and I talked about that. So
Yeah.
I just want to say, over these past two sessions, we've talked about the science behind, stem cells, why they're being explored in autism, inflammation, immune system, how those systems interact with the brain. But one of the biggest questions that parents still have is, what does the actual infusion process look like? What happens before treatment? What happens during the infusion? And what exactly are the cells doing once they enter the body? And so I just want to let everyone know that that's exactly what we're going to walk through step by step in our next session next week. Not theory, the
Yeah,
real process. So,
absolutely.
Jory's going to walk us through how the cells are prepared, what happens during the infusion, what makes their process different, what you should understand about number of infusions, pricing options, and what the process looks like if you are a family interested in exploring this further. So, and like I said earlier, Jory, you're going to share with us some experiences from families that you've worked with so they can
Yeah.
hear what other people are seeing. And I think this part is important because when parents first hear about something like cell infusion therapy, it can feel really overwhelming or unclear.
Yeah.
And I just want to let you guys know, if you have questions, we want to hear from you. So, since next week we're walking through that process, we'd love to know, what parts you're interested in the most. And
Oh,
again,
absolutely.
Jory, I just want to, thank you. But I think, next week we're really pulling back the curtain so they can see exactly how it works and ask the questions that matter to you as parents.
Absolutely.
So I don't know, Jory, do you want to add anything specific about what parents can expect next week?
Just be ready if they have questions like what maybe we're doing that's different, or maybe what some of the other people are doing in comparative. We can add some of that in. But other than that, I'm used to 2 hour Q&As with a live audience sitting in front of me, so I'm not worried of any question.
Of course.
Tell them to bring
Of
it.
course.
Bring whatever
So
question you have.
So if you've been wondering what would this actually look like for your family, that's exactly what we will be walking through together next week. Thank you for being here. Thank you for understanding. We went a little over today. There's just a lot to
A
share.
lot.
And again, if you have questions, email them over. You are so welcome. Everyone, we're glad you were here. Jory, thank you so much as always for your time. I look forward to next week.
Absolutely. Be ready to see you next week.
All right. Thanks so much.
Thank you.